Hello guys, this is Indian Medico, and in this video we are going to discuss about allergic disorders of eyelids. First let us discuss about acute allergic edema of eyelids. The causes of acute allergic edema of eyelids include exposure to pollen or by insect bites. The clinical features include sudden onset of bilateral boggy periocular edema as you can see in this picture. There can also be associated chemosis. The treatment of acute allergic edema is by observation. Systemic antihistamines can be given in severe cases. Now let us discuss about contact dermatitis of eyelids. It is an inflammatory response caused by exposure to certain medications like eye drops, cosmetics, or metals. An irritant can sometimes cause non-allergic toxic dermatitis. Now let us discuss about the pathogenesis of contact dermatitis. The individual is sensitized on first exposure and develops an immune reaction on further exposure. Contact dermatitis is a type 4, that is delayed hypersensitivity reaction. Coming to the signs of contact dermatitis, there can be lid skin scaling, angular fissuring, edema and tightness as you can see in this picture. There can be associated chemosis, redness and papillary conjunctivitis. There can also be punctate epithelial erosions. Coming to the treatment of contact dermatitis, we should advise avoidance of allergen exposure. Cold compresses can be given for symptomatic relief. Topical steroids and oral antihistamines can also be given. Now let us discuss about atopic dermatitis. It is also known as eczema. It is a common idiopathic condition and it occurs in patients with asthma and hay fever. Coming to the clinical features of atopic dermatitis, eyelid involvement in atopic dermatitis is relatively infrequent, but when present is associated with generalized dermatitis. Patients can present with thickening, crusting and fissuring of eyelids as you can see in this picture. It is associated with staphylococcal blepharitis, vernal or atopic keratoconjunctivitis. It is important to remember that herpetic blepharitis and keratoconjunctivitis are more common and more severe in patients with atopy. This is known as eczema herpeticum. Coming to the treatment of atopic dermatitis, we have to prescribe emollients to hydrate skin. Mild topical steroids like hydrocortisone 1% should be given to the patient. Uncommon ocular associations of atopic dermatitis include keratoconus, cataract, and retinal detachment. Thank you.